Guide technique. Guide technique involves assisting an individual who is blind or visually impaired with regards to getting to a specific location. More commonly known as sighted guide and recently referred to as human guide, this technique is now simply referred to as guide technique. This change in terminology is an accurate term because an individual does not have to have sight to be the guide. Guide technique can be used in a variety of settings and situations. For example, navigating through a busy airport, locating a seat in an auditorium, or crossing an unfamiliar complex intersection. Please note that guide technique is in no way a replacement for the independence that is provided with a cane, guide dog, or mobility aid. When initiating guide technique, make sure to ask the individual if they need assistance before making the assumption that they do. Sometimes the individual may just need some verbal confirmation of direction or current location. If the individual chooses to utilize guide technique, the guide simply touches the back of the individual's hand with the back of their hand to verify position. This way, a point of reference has been established. The individual can then follow up the guide's arm right above the elbow, gripping it like a Coke can. Providing information about the upcoming environment is helpful and appreciated. For example, we are getting close to a drop-off, or we are going to be traveling through a narrow space. When traveling through a narrow space or crowded area, the guide can take his or her arm and put it directly behind their back as seen here. The individual being led can then trail down the guide's arm, gripping at the wrist so that the individual is directly behind the guide. An alternate way for negotiating narrow spaces is putting the left hand on the guide's left shoulder or right hand on the right shoulder while standing directly behind them. One option may be easier than the other based on the height of the individual involved or general preference. Transferring sides. With regards to transferring to the other side of a guide, the individual being led can simply trail across the back of the guide with the hand to locate the opposite elbow, then grip with the appropriate hand for that side. This is an easy way for an individual to transfer to the opposite side of the guide to access a point of interest. Changing direction. With regards to changing direction, the guide and individual being led simply make a 90-degree turn to face one another and another 90-degree turn to face the opposite direction. Then guide technique is resumed, traveling in the new direction. This effective method eliminates walking around in a circle, creating more work and confusion than necessary. Thanks for watching. Be sure to like us on Facebook and visit our website at www.tylerlighthouse.org.